Thank you. Our keynote speaker tonight is Dr. Gus Krucke, and he is this year's recipient of the prestigious Leonard Tao Faculty in Humanism and Medicine Award that's sponsored by the Gold Foundation. Dr. Krucke is a Florida native who received both his undergraduate and medical degree from the University of South Alabama. He did his internship and residency in internal medicine at the University of Texas Medical Branch in Galveston, and served as chief resident, and then joined the faculty at UTMB, where he was director of Life Flight, as well as the director of the EMT staff. In 1966, Dr. Krucke served as a staff physician at the John Peter Smith Hospital in Fort Worth. And in 2002, we were fortunate when he came to University of Texas Medical School at Houston to be the director of the HIV specialist unit. He's the medical director of the Bering Omega AIDS Hospice, where he recognized as the Volunteer of the Year for the professional services in 2009. He's board certified in both internal medicine and emergency medicine. I can tell you that Dr. Krucke was selected for this Humanism Award largely based on the testimony of his faculty colleagues, which is a high honor indeed, who spoke about his devotion to patients and the extent to which he advocates for them, especially those who have very little or no resources. We learned that he does not just check on the patients by phone or looking at the medical chart. He's there in person, visiting the patients, talking to the loved ones, and ensuring the very best possible care. I'm delighted to welcome our principal speaker, Dr. Gus Krucke.
Oh my, after that my head is so big, and what am I supposed to say? It's an honor to be here today to share an awfully important moment, not only for all of you, but for the loved ones, family of young men and women who are going to enter a phase in life that is just unparalleled. The white coat ceremony represents privilege, and these young men and women are privileged with the opportunity to do something in life that nobody else gets to do. The relationship between a patient and a physician is sacred. There's nothing like it in any other profession. If you ask your college buddies in a few years how they're liking what they're doing, many of them will be happy, some of them won't. You'll be studying hard. You'll have rings under your eyes from staying up late studying, and that's all part of it. But I think if you ask these folks a few years down the road, when you've had the opportunity to take care of patients in a variety of different circumstances, you'll find that this can be the most enriching experience for you, and an unparalleled one, as I mentioned previously, for any other profession. So you should take the responsibility seriously and enter into this contract that you'll sign tonight and that you will swear to as well with your oath, to not only learn how to become a scientifically excellent physician, somebody who practices from the foundations of evidence-based medicine, but somebody who has the ability to care. And this caring is so important. We see a lot of cynicism every day. We see it on the news, we see it at the workplace, we see it among our friends. And really the only way to combat that type of cynicism is to bring a little light into the world. And even at my advanced age and many years practicing medicine, I think that I've had my moments, we all do, and you all will as well. But once you center yourself and understand how important what you're doing is, and how important it is to the people that you're caring for, and how much love they give to you, it centers you in a way that is remarkable. You will need to learn that the world is a very different place than you really believe it is now. As you grow in the medical profession, you meet a lot of different people, and we have to learn how to accept the differences in other people, embrace them, and every time we sit down with a patient, be able to look them straight in the eye and have them feel that you're not sitting on a pedestal, but that you're their equal and that you're their partner in their care. This is a position of power as a physician, and we have to be careful with that. And we have to understand that it's intimidating for folks to go see the doctor. And it's intimidating for folks to disrobe and to share their most intimate secrets with you, things that will not happen in any other aspect of your life. So this relationship is critical, and your acceptance of other people, whether they're gay, whether they're straight, whether they are of color, whether they are of different nationality, doesn't matter. You need to check it at the door. Your job is going to be to execute scientifically excellent and compassionate medical care to the folks you come into contact with every single day. And every single patient expects it at every encounter. You need to be aware also that you're going to change a lot. And the folks that you love are going to notice you changing. You're going to learn a whole lot. You're going to meet a whole lot of different kinds of people. And it's nice to stay grounded with folks like those out here, because they'll slap you down pretty quick, I think, if you get pretty full of yourselves. I know my parents did. And it's a good thing. And so that's why I'm kind of glad you all are here too to hear it. You need to also be aware, and this sort of parallels my thoughts about acceptance, that all of us deep inside, if we're really honest, have little ounces of prejudice. And as we grow in life, these things can come up and bubble up, and it often happens at the worst time. The patients that are the most difficult, or the situation that's the most difficult. And it's in those moments that you can challenge your prejudice, whatever it might be, and grow, recognize it, and change. That's the beauty of the life that we live on this planet. Also, I think you're aware, at least to some degree, that becoming a physician involves a great deal of sacrifice. It's not a 9-to-5 job. You're not a banker. The first 2 years are kind of rough because you're studying a lot and you kind of wonder, when am I ever going to get to see a patient? But believe me, it happens. And then there's so many patients, you say, stop. So it'll come, don't worry. And take the extra 5 minutes at the end of the day to go see the patient who's really struggling, or maybe the one that's coming closer to the end of life. Maybe somebody you plop down in the chair beside them and watch TV with them for 5 minutes or so. Don't really say so much, and give them a pat on the back and say, hope you have a good night. It's the extra time, it's the extra mile that makes you a physician of excellence, not only from the clinical perspective, but from the human perspective. So I want to share with you in closing about a clinical case. I mean, what kind of a doctor would I be if I didn't present a clinical case? And what sort of teacher would I be? I'll have to get the technology correct, but I'm going to kind of paint a picture for you of a clinical situation that I was in the intensive care unit while I was at John Peter Smith Hospital. And since I trained during the 1980s, during the AIDS epidemic, I had to grow up pretty quick when I was their age, and we were admitting a number of patients every night with HIV/AIDS, and most of those patients who were admitted to the hospital didn't live. And so my experience with end-of-life issues very early on was pretty extensive. So it's not something with which I'm unfamiliar. And in the intensive care unit, as you know, there are a lot of sick people and not everybody makes it. And there was one patient in particular who was a favorite of ours. You hate to pick favorites, but you know you're going to have a few. And you just enjoy their company, their humor, their intelligence, whatever it might be. And this particular individual had been in the intensive care unit a couple times with pneumonia, pneumocystis pneumonia, which is an AIDS-related pneumonia. And this was at a time when we really didn't have many drugs to treat folks who were living with HIV/AIDS. And he got sicker and he got sicker and was on the ventilator and was on a number of different intravenous medications to keep him alive. And it became clear to me as the attending physician that this dear patient had entered the dying process, and that as a physician there was nothing more that I was going to be able to do to save his life. It's a terrible feeling when you know that you can't save somebody. But it's a good feeling to know that you can make a transition, you can be honest with the family, you can be honest with the patient, and let them know straight up what's going on, and then be with them during what is a very difficult time. And it was difficult, and we were blessed to have his sister around all the time, who had a great sense of humor. And if I can get my technology correct, I'll share with you that she had a gorgeous voice, and we didn't know this. But as I moved into the room and started to disconnect the life support at the patient's and family's request, and tried to make the patient comfortable during this dying process, she sang to him and to us a very wonderful song. And I'll see if I can get it to work.
Looking up the skyway, there's a rainbow highway to be found, leading from your window pane, just a step beyond the rain.
And so this gorgeous voice we didn't even know about that came out of this young lady sang this song to her brother as he died. And it's something that I will never forget. And it changed me. And it reminded me in each and every moment how right my professors had been about the need to care, about the need to study hard, to know as much as you can, but in the end, just to be a good physician. And that's what I want for you all. Thank you.